Nikki and I'm going to be showing you our cryolipolysis today. So this is our fat freezing machine, which can be done on a lot of different areas of the body. Tummy, so lower or upper tummy, arms, inside thighs, love handles. On men we can do the chest, we can't do it on women. So lots of different areas that we can use this treatment on. And I'm going to go ahead and start doing the treatment, and whilst it's on I'll explain a lot more to you. So as we're freezing the fat cells, we need to protect the skin. So this is an anti-freeze membrane. It's very cold when it goes on your tummy. And this is just going to protect the skin whilst the fat cells are being frozen. So we're going to be doing Laura's tummy today. So this will be cold. So we pop this over the area that the machine is going to be placed on.
That was rather chilly, I think, very brave.
And then just setting the machine. So we cool to -5 degrees. So that is the temperature that the machine works at. And we leave it on for 45 minutes. So if you're having a double area, for instance inner thighs, we will sometimes do, if it's a small area, 2 30 minutes. For instance, arms would always be 2 30 minutes, and then love handles and inner thighs can either be 30 minutes, 45, depending on what handpiece we're using. So we have 3 different handpieces, which I'll show you in a second, which are used for different areas depending on the number of fat cells that are in the area. So I'm popping the handpiece on so you can see in here, this is where the fat cells will be taken up into. These here are the cold plates, so this is what freezes to freeze the fat cells. So everything that goes into here will be frozen to -5 degrees. So just making sure that I'm getting it in the middle. And then I'm going to turn it on, and slowly the fat cells are vacuumed up into the handpiece. So we start off at quite a high pressure. Does that feeling alright?
Yeah, fine.
So it can feel a bit uncomfortable for those first few seconds because we're up at an intensity of 60 for our vacuum. So we're then going to reduce that down to 30. And now the body has already let the fat cells go up into the vacuum. It doesn't need to be so high, so we can work at a lower vacuum, which is more comfortable for you when you're on the couch. And we could probably even go down to 20 for Laura. So sometimes we'll stay at 30, sometimes at 20, so is that a bit more comfortable now?
It's fine, it's absolutely fine.
So you can see a red light flashing. To start with, it goes hot for 3 minutes, so that's just preparing your skin and preparing the body for the cold that's about to come. It starts to separate out the blood cells. So the reason that we take the fat cells away from the body is obviously we don't want to be freezing directly into your body. So lots of people always ask, does it freeze anything else? No, because it's taking those fat cells away and it's just freezing the fat cells that are here inside this handpiece, so everything else is completely safe. You don't really feel much apart from a warming to start with, and then it gets cold. But even though it goes all the way down to -5 degrees, it doesn't feel that cold to you when you're having the treatment. You know, the rest of your body doesn't get cold. That's something we're often asked. You know, when we take it off, you can touch it and it feels really freezing cold, but actually you haven't felt that cold in your own body. So it's not an uncomfortable treatment to have. It's just that usually just those first few seconds when we first take it up, and it does depend on the area. So sometimes inner thighs a little bit more uncomfortable, or sometimes the love handles can be a little bit more uncomfortable to begin with. But you just get used to it after a while, and it kind of feels normal. So the treatment is a little bit boring for us. It's really just a magical machine. So we just basically leave this on now for 45 minutes. And we're just checking you're comfortable. We stay with you all the time. We're just always checking that the vacuum is still up high, checking the temperature, checking that everything's okay with the machine. But apart from that, we'll just sit and chat to you when we're having this treatment. So there's nothing really to worry about. So I'm just going to check all the levels, that's all fine, and in a few seconds it's going to start flashing green. There we go. And that is going to now get cold. So at the moment we're at 42 degrees. So it heats up first to 42, and then it will slowly make its way down to -5. So that takes a few minutes. So these are our other handpieces. We have 3 different size of handpiece. This is the smallest one here. So as you can see, this would be used for arms, top of the arms, and sometimes if we're doing a man's chest, we'll use this smaller handpiece. And then this is the medium. So we use this quite a lot for love handles, sometimes inner thighs, tummy. It obviously depends on what we're trying to fit into each handpiece. And then we've got the 3rd size handpiece, which we nearly always use on tummy. So this is the one that Laura's got here on her tummy. So the main thing that you really have to consider if you're thinking of having this treatment is that you really have to up your water intake. Or for those of you who already drink a lot of water, then obviously keep it the same. So you really need to be taking on 2 to 3 litres of water every day for this treatment to be successful. So we're breaking the fat cells down in the body, remembering that you can't regrow fat cells. So once we kill a fat cell and it's passed out through the system, you can't make new fat cells. So if you find that you're putting on weight, it's because you're inflating the fat cells that are already there, as opposed to making new fat cells. So once we take those fat cells away, they can't be inflated, so you can't gain weight in those fat cells. Obviously, you can still put on weight in other areas, so you want to try and keep a good, steady calorie intake, and as healthy a diet as you can whilst you're going through the process of the cryolipolysis. But most importantly, the water, once we've broken those fat cells down, it's going to be flushed out by the lymphatic system. So the water will just help with that and keep flushing everything away. The next day, all we will really notice is you're going to the toilet a bit more. That's good, that's what's supposed to happen. Some people can feel a little bit tender the next day, but nothing dramatic. You should be able to just come in and go back to work or go about whatever you were planning to do for your day. So there's not really any discomfort after the treatment. Some people can get little small bruises. This is just like a suction bruise and it goes within a day or 2. Some people don't get that at all. It tends to depend on the area. So the trickier positioning areas can be the ones that bruise. Obviously if you bruise easily, then you might find that you do, but it's not a painful bruise, it's just a suction bruise. And then that's it, you just keep drinking water, nothing really to prepare beforehand. Just make sure you haven't just had a meal before you come for the treatment, only because it would be uncomfortable because we're obviously pulling on the tummy. Unless you're having another area done, it wouldn't be so important. So who can have this treatment? If you have any problems with your liver, you can't have this treatment. So the treatment is relying on a really good lymphatic system and your liver to process the fat cells and to help them leave the body. So if you have any kind of lymphatic problems, anything like that, then you wouldn't be able to have this treatment. Also, if you're pregnant, and then there's some other conditions where you wouldn't be able to have it, like haemophilia, that sort of thing. But obviously come in for a consultation, we do a free consultation, so we'll be able to tell you if the treatment is right for you. The other thing is that you need to have enough fat cells to vacuum into the handpiece. So you need to really be able to pick up a little bit of fat. If you can't do that, then we're not going to be able to put it into the machine. So if you're just struggling with a really small area that is obviously important to you, but is not something that you can lift away from your body, then we've got the other machine, the cavitation, which would probably suit you better because that can work on any amount of fat cells. So again, the consultation will help us decide which of the 2 treatments is best suited to your body type. So the treatment takes between 8 and 12 weeks to fully work, and some people it's still working for another month or so after that. So it's not a quick fix. The other machine with the cavitation is very much an instant quick fix treatment. This treatment is a long-term thing. You're going to really slowly see the results over time, and that's because the fat cells have to leave the body, and because we have killed so many fat cells at one time that it takes a while for the cells to go through that process and leave the body via the lymphatic system. So a good choice is to have this treatment with 3 cavitations. That's normally what we recommend. So once the fat cells have left your body, you're going to have some empty space where the fat cells used to be. So the other treatment with the cavitation also uses RF, radio frequency, and that tightens and firms the skin. So this is a really good thing to combine with the cryolipolysis because it will tighten up any loose skin that's left once the fat cells have left the body. Also, it's really good because it gives you that instant fix. So if you're perhaps preparing for an event that you know is a few months away, but you've got something in the meantime as well, then you can have those cavitations to get your instant loss whilst the cryolipolysis is still working. We take before and after photos, really important for you and us to look back on at the end because it happens so slowly and you see the change so slowly, you start to get used to your new body along the way. So a lot of people, when they get to the end of the 12 weeks, don't actually remember exactly how their body was at the beginning of the process. So it's a really good way to look back at the before and after photos just to see how far we've come with the treatment. So we do an initial consultation. You always need to have a consultation before this just so we can check the area that you are concerned with, whether this treatment will be an option for you and go through any medical conditions, and then you would have your treatment. You would have your 3 cavitation after that, either a week or 2 after, or you can spread them out over time depending on really what you've got going on, how impatient you're feeling. You might want to have them all towards the beginning. And then at the end of the 12 weeks we would have another consultation just to look back and see how you've got on. Obviously you can chat to us along the way, we'll see you along the way for your cavitations as well. But the main thing when you leave us after this cryolipolysis treatment is to remember you have to drink lots of water. So that's something that you, if you're having the treatment, really need to sign up for and really listen to, because it does affect how well the treatment works. So Laura's still got quite a while on this. We've done 15 minutes now, and we're going to leave her on up until the 45 minutes, and then we'll come back and we'll just show you how we take everything off and how the skin and the fat cells look and feel at the end of the treatment. Okay, so we're coming to the end of the 45 minutes now. Laura's literally got just over a minute to go. So she's been down at -5 all the time. Nothing feels cold around here, so it's literally just going to be the area that's been up in the handpiece that's going to feel really cold to the touch. So when the machine stops, it beeps and then it just lets everything go. So it's quite a nice sort of moment when it first comes off. And then we take away the antifreeze membrane, and then we just give a good massage to break down the fat cells. They feel a bit frozen under the skin, which they are, but so it's just breaking them down so to help them pass through the lymphatic system more easily and just helping the lymphatic system to start doing its work. Then when you stand up, you feel exactly the same as you did before, so there's no miracle stand up and see a difference. It really is sort of a good 3 weeks probably before you start to see the initial results, and then, as I say, it's a long-term thing. So expect to stand up, feel the same, and leave the treatment room feeling as you did when you arrived, which is very different to if any of you have tried our cavitation. That's quite different. You do stand up and instantly feel firmer, tighter, and you can see a difference in your before and after picture straight away. So this is very different to that. So there we go. That's just ended. And it lets everything go. So we just take that out of the handpiece.
How soon after having the ice can you have the cavitation session?
So
first one?
we can do the first cavitation about a week later.
Okay.
And then some people leave it a couple of weeks.
Totally numb. Yeah, really weird feeling.
So you can see there's a redness on the skin now, on Laura's skin, and I'm just literally massaging to break down those fat cells. It feels nice and cold.
Where it was, it feels really numb.
Yeah.
Like I can't feel your hands.
Right.
It's only around the edges that I can feel your hands.
So it really is freezing cold in that area, but just here it's a normal, really warm temperature. So we're not making the whole body cold in any way.
Yeah, no, it's so comfortable that I drifted off in that 45-minute gap. Just briefly. It's nice.
And that's it, and then you would be ready to go and come back when it's time for your first cavitation. Obviously have a look on our website for our prices and the different options of the packages, and do come in for a free consultation and we'll be able to advise you which treatment is the best one for you.